Great. Thank you, Nikki, for the introduction, and thank the chairs for selecting me and choosing this really important topic. The title today is Health Equity and Access to Medical Countermeasures, and I'm happy to go through for about 20 minutes many ideas to really address what was well-established challenge that we have of building trust. So right from the beginning, let me just say, I'd like to charge sort of as St. Jerome thinking, the uncertain sciences. What do we need to do for clinical care, research, and public health with the areas that were just mentioned? Trust and confidence in science, vaccine hesitancy, and our health policy and governance. And it goes back to the idea of a Sisyphean challenge. And if you look at the old 5th century BC Greek jar that's at the British Museum, you see Sisyphus, who was a legendary king who was sentenced to immortality. And the legend goes that he was sentenced to push the rock up the hill, and it would never make it to the top and go down and go back over and over again. And I feel that's kind of where we are today. And I'm going to start with just what we knew and what we've been doing. The key to containing Ebola, I was on the CDC Board of Scientific Counselors for Office of Infectious Disease at the time, and we knew what to do with Ebola, and we talked about creating a single authoritative source. And I'm not saying that that was done correctly, but we knew that there was something that could be done, and we had the tools to do that. Now, if I fast forward to where we are in 2020, I'm on the board of the National Academy's Board of Global Health. And we were speaking about the challenges that we saw already with then SARS-CoV-2 in January of 2020. And a few of us quickly wrote, Larry Gostin, Ruth Parker, and others, the need to already create a coordinated, trusted source. We knew it was a threat to the credibility, and we knew what we needed to do. We actually had this paper out a week before it was even called a pandemic. And the reason why it says number 5, it was the top 5 paper at the academies for the year, but still to this date, we don't believe that this coordinated, trusted source exists. At the same time, I edit the Journal of Health Communication. Let me thank Dr. Loy for contributions and the background. I've been doing this since 1995, 27 years, the journal. We've had hundreds or thousands of different articles. We very quickly put together what to do, vaccine communication in a pandemic, vaccine literacy to reduce hesitancy, restore trust, and immunize communities. We put this out even before the vaccine was on the market. And while we had promising strategies, again, we knew that the rock was going to be very difficult to push up this hill. So we continued on with the scientific base, and we knew that we needed to really get a lot of people involved in terms of the intermediaries. And unfortunately, what we had happening was the beginning of not only threats from, you might know from my American accent, the President of the United States calling the news fake news, but we also had independent arbiters, and we also had politicians deciding what to do. So we didn't have health with the scientific base that we all thought we could do. And I know both yesterday's, the chairs, we're talking about the independent panel for pandemic preparedness and response. And we know from really what Helen Clark was quoted as saying and others, that our current institutions, public and private, failed to protect people from a devastating pandemic. And without change, these institutions will not prevent a future one. Now that was in 2021. For 2 years, we knew what to do, but the CDC also did not do a great job. And this is just the last quote from Steve Morrison and others at SACE, who put a whole expert panel together to give some ideas to build the CDC that the country needs. And still, again, this is early 2023, they said the CDC does not have the capacity or resources to communicate effectively. CDC struggles to convey the most essential evolving public health messages during a crisis to audiences and communities across the country. Now, I did grab data from some different sources for the title today. And one of the best sources was from NORC in Chicago, which had a recent study that was published, although it was fielded at the end of 22, on what the scientific community, how they were viewed in terms of confidence. And as you can see, there has been a drop over the last few years from 48% to 39% of people having a great deal of confidence in the scientific community. I think what's more troubling on this, although it's only 1 year on this trend data, is those who have hardly any, that we're up to 13%. And we're starting to see a stronger base in a number of different surveys of people hardening on the opposite of science. The same question was asked about medicine. For the medical community, I'm going to name some institutions. As far as the people running these institutions are concerned, would you say that you have a great deal of confidence, only some, or hardly any? And as you can see also in this, the hardly any has peaked at 16%. And we also have a drop-off, although not as much in medicine as we have in science. Now, at the same time, Edelman does a trust barometer every year of looking at health authorities and business and see how people are in terms of the trustworthy sources. And let me say what was strong here is that the national health authorities continue to be more trustworthy, according to the Edelman Trust Barometer, than others in the national government. So the health authorities that are at the governmental level. What continues to show and has been consistent year on year is employers, and the private sector continues to be a trusted source of information. And although many of us worry about the social media, it's not as much as a trusted source across all ages, but it does make a difference if we broke this down further. But in the interest of time, we won't go through this, other than to realize that our health authorities and employers also still have some good trust. Now, I know Nikki and others have been involved with the U.S. Institute of Medicine, now the National Academies. And what we've always said there is what health is what we do together as a society to ensure the conditions in which everyone can be healthy. And that's been the challenge of how we have been able or unable to address the COVID pandemic. And I think part of it was how the media has put the information out, particularly trying to put the challenge of vaccination and calling vaccine hesitancy a big problem. And it wasn't just this on CNN in 2020, mentioning vaccine hesitancy may present the next obstacle. I also was quoted as saying warp speed was a problem of building some trust in terms of science. And the BMJ reminded that it was WHO in 2019 who had vaccine hesitancy as a top 10 threat. And while later we'll define what vaccine hesitancy is, unfortunately, vaccine hesitancy took a life of its own, and it actually gave some ideology to people. And Tom Frieden, former CDC director, warned of this in the New York Times, that vaccine hesitancy was making a better story than just vaccination in general. So what ended up happening is you had the media, unfortunately, putting everything in a right or wrong or yes or no or not on some equal footing, rather than the preponderance of evidence that we've known for years that vaccinations work and have eradicated and eliminated diseases in our lifetimes. So what is vaccine hesitancy? The WHO SAGE Committee, which is a Strategic Advisory Group for Emergencies, defined it as the delay in acceptance of refusal of vaccination despite availability of vaccination services. And let me commend Heidi Larson, who really has been one of the leaders in this and looking at trust in vaccines. And when we wrote the article in 2011 in Lancet, I was really the last on the communication side. We were trying to get the world to talk about vaccine confidence rather than vaccine hesitancy. But unfortunately, as later seen, and Heidi wrote in the New England Journal last year, we've lost that battle, and vaccine hesitancy, unfortunately, has taken on an ideological mission of its own. There's a complex phenomenon behind it. There's more than 70 factors that influence it. There's a whole value of vaccines that are out there. But in looking at influenza vaccine, it's clear that people are breaking on, not only on health literacy and education lines, but also in the trust of science and governments and other misinformation. I worked with some colleagues to try to change the narrative on vaccine hesitancy in the United States, along with Eric Snyder at the Commonwealth Fund and some colleagues at Ascension Health. We looked at 140,000 people early in the pandemic in the U.S. that were wanting to get vaccinated, but were unable to get vaccinated. And the media was calling a number of these people vaccine hesitant. But we basically were saying, no, they were vaccine ready. So the blue were nearly 89% of the public were ready to get a vaccine. We just didn't have access. We just didn't have the ability to get them to either a clinic or to get the vaccines to wherever they might be. And I think the characterization that we're trying to move, and this was Heidi Larsson's term that's bolded there, is that we can move people in their stage of readiness to vaccination. And I think just why it may be ominous of where we are with trust in science and medicine, we can move people back into the right direction with communication and with adequate systems and policies that I know we'll be talking about with our panel. This is the number that Tom Boyke at the Council of Foreign Relations has quoted in his article in The Lancet of 318,000 vaccine-preventable deaths in the United States due to the consequences of not only vaccine hesitancy, but people not getting vaccinated. Others put this number anywhere from 200,000 to 500,000. The bottom line is it's a significant number. And as you can see, the top 5 reasons, it's 42% don't trust vaccines and 35% don't trust the government. So it's a lot about the trust in the intermediaries as well as the science that we need to overcome. And I've been fortunate to work with Jeff Lazarus. I know one of the other co-chairs of this, and thank Jeff for the opportunity to collaborate now. For 4 years, we fielded a study in 23 countries. This was the first year that we did in 2020. I'll just quickly note here that the vaccine hesitancy, it did in fact move, although we were calling it more vaccine confidence, that people were able to move up from 59% at one point, or it's 59% of the world's population, but it increased to 79%, and we lump all of this together. What I think is most interesting, particularly with many French colleagues, not only here in the room and otherwise, is that France was looked at as a very vaccine hesitant or lack of confident country, and as you can see, they had a population that was in the 50s, but with adequate policies, there's a 38.7% increase over the 3 years in terms of policies and communication that move people to get vaccinated. There's another study that was just out or will be released. This is a preprint. This was presented yesterday in the Vaccine Congress in Glasgow. And I'm able to get 2 slides from, again, the Vaccine Confidence Project, Heidi Larsson's work with colleagues, and the 122 countries, but these are highlighted, that vaccine confidence, now this is on all vaccines, not just COVID vaccines, unfortunately also have been going down, decreasing in 24 countries. And the confidence is only up in a few countries, as you can see. Again, France has been quite successful in terms of vaccine safety. Similarly, the next slide is just on the importance of vaccines. I think what's more troubling here in looking at vaccines for children is that there's been a great drop-off, double-digit drop-off in over 46 countries. So our work is cut out for us in terms of addressing vaccine confidence and trust. Now, I know the organizers asked me not just to paint a bad picture or the picture of the world as it is, but maybe as the world as it can be. And that's kind of the idea. What is the evidence that we have? How can we address health equity, vaccine equity, and the challenges that we all face? This is just a mix that we know that the science was able to come up with a vaccine that worked. But the social sciences were sidelined. And if you look at the top right, Ashish Jha, who was leading the COVID task force most recently for the United States, said they didn't get the social science right. But even more importantly, Francis Collins, who ran the NIH director for a number of years, said the same thing. We need to get knowledge from credible sources. The articles on the left are just a number of people who've been writing about this for years. I was fortunate during my Harvard fellowship, I worked with Barry Bloom and Larry Gostin, and that article on the bottom on safe vaccinations for a healthy nation. And we wrote about law, science, and communication as the 3 elements that needed to work together. And unfortunately, that evidence base, we don't believe, has been followed at this time. And we also have, facts don't matter. And COVID, while we thought it would be more important to say we were able to overcome from a pandemic that we hadn't had for over 100 years, nonetheless, facts haven't mattered. And what's even worse and more troubling is the health communication science there's a disinvestment. The two articles that are on the right in JAMA are talking about $153 million that was just pulled or not awarded or not even put out for researchers to bid on in terms of advancing health communication science due to many political reasons that the Dean Schillinger writes about in the article if you search it up. So what do? It's not an easy place that we're in. And I like to, in my field of health communication, I lead a program, Health Communication for Social Change. A lot of it is taking from other fields, whether it's political science or history, as in the case of Neil Ferguson, who wrote The Square and the Tower, who's based in the UK, and Anne-Marie Slaughter, who wrote The Chessboard and the Web, formerly dean at Princeton, Woodrow Wilson School of International Relations, now the New America Foundation, have both written about how we communicate in our world. And Ferguson's work is more of, that's Siena. In the old days, the tower, it would whatever the educated or elected folks would say, people would follow. And we had a traditional system, rewards and power, and a way that people would make decisions based upon logic, or even, shall we say, the old ancient canons of rhetoric of Cicero and Quintilian there in Italy. And then similarly, what happened now, though, is the chessboard and the web has the whole web, that we have a multinodal network, just like we have a multipolar decision-making process. And Anne-Marie writes that we really need to create these hubs and these networks and motivate people of where they're getting their information. It's easier said than done, and how we curate that is not so simple. Now, Jeff Lazarus led a Delphi consensus that was published in Nature earlier this year. 386 experts came together, which I know what many of you have been doing for years with WHO. We need a whole-of-society approach. But we also need a whole-of-society approach from multiple disciplines. And that's what I think was clearer in this group, of the need for business and civil society, engineering, faith-based communities, modeling, military, media, and psychology, all need to come together to figure out what we can do to end the next, or prepare, as this meeting is about, the next public health threat. Now, my last couple of slides are just some ideas that are a little bit further. If you wanted to look in the vaccine area, we published a paper called Multisectoral Actions to Build Trust at the Local and Community Level to Promote Vaccine Acceptance. This was an expert roundtable that was just published in Vaccine this summer. And similarly to what Jeff Lazarus and colleagues have come up with on the broad Delphi on the pandemic preparedness, we need the same thing even dealing with vaccination. Multisectoral responses, trusted local stakeholders and messengers, combating mis and disinformation, ensuring consistent recommendations and messaging. And the simple term that I like to use, it's not just the message, it's the dosage. We have to say it multiple times from multiple people, trustworthy sources, working with media, and then finally, local healthcare professionals, including community health workers, as key players in effective vaccine communication. I can't say how more important both civil society and community-based groups are in addressing health and preparing us for a better future. So the final slide is, again, Sisyphus. This goes back to Titian's work in the Prado, also pushing the rock up the hill. How do we do this? How do we rebuild trust and advance equity? We have new technologies. We are nowhere near as clever. I could have shown the whole infodemiology scatter graphs that show how the negative impact of misinformation is out there, drowning the positive impact of science and evidence-based information. We can communicate consistently and credibly. How do we do that? How can we do that with government and society and business and others? And I've been working with multisectoral responses with a business group, the U.S. Council for International Business, to try to get people to work together at multiple levels to build trust and the societal agenda. So how do we galvanize that? And we need that in all sorts of areas. And then finally, do we need a new initiative, but something that's reminding us on strengthening information on global health threats? I called it Insight in that article for the Council on Foreign Relations, Overcoming Cacophony in Public Health Communication After COVID. And let me say that article and others just reminds that we need a pandemic warning system or even an outbreak warning system, much like we have a weather system in place that people can understand with a health literate lens to it at all levels. And then this is my final slide. I believe we can build trust, we can build confidence, and we can address health equity, including access to medical countermeasures that I know Els will speak about. Camus wrote about Sisyphus years later, or centuries later. There's no longer a single idea explaining everything, but an infinite number of essences giving a meaning to an infinite number of objects. The world comes to a stop, but it also lights up. We came to a stop during this pandemic, and we have an opportunity for the world to light up. I'm really looking forward to the discussion with Dan and Michelle. Appreciate the opportunity today to share this with you, and looking forward to the question and discussion. Thank you very much.